Hello and welcome to week 1 live chat with Dr. Safian. I am Dr. Safian and we're going to have a great semester talking about learning about healthcare systems. And I wanted to make sure that I got you started off on the right foot here in week 1. Aren't you excited that we're already online? So the coronavirus whole thingy will not interfere with your expected date of graduation with your master's degree. All right, so let's get started. All right, so first I want you to understand that when we talk about healthcare technology or healthcare information technology, HIT, that is not one thing. That is an umbrella term that refers to many different systems, including, but not limited to, electronic health records, also known as EHR, and some of you may have heard electronic medical records, EMR. They're not identically the same, but the terms are used interchangeably. So for purposes sake, we're going to call them EHR, okay? Electronic Decision Support Systems, also known as CDSS, and sometimes in the singular CDS, Clinical Decision Support. Computerized Physician Order Entry, CPOE, which started out as e-scripts to send prescriptions electronically from the physician to the pharmacy, but now has, in most cases, has been expanded to include the imaging department, as well as respiratory therapy and other departments wherever a physician needs to, yes, write an order, okay? Patient portals, very important for good patient engagement. Health information exchanges, abbreviated HIE, and telehealth, also known as telemedicine. And those are used interchangeably. Again, yes, there are fine differences between telehealth and telemedicine, but for our purposes, you can use either term, whichever makes you feel comfortable. The thing that I want you to focus on in this class, starting right now, is you must be specific when you are talking about a healthcare system, technology system. You must be specific. Which system are you referring? Is it EHR, CPOE, HIE, what? Because that way your education will actually give you value to your career. Without the specificity, you're going to have problems in pinning down your knowledge so that you can use it. And that's really what this is all about. Why you're in class, why you're in this program, because your master's degree is just a piece of paper. Yet, you must remember that behind that piece of paper is meaning, and that's the knowledge that you are expected to have as the holder of a master's degree from Colorado State University Global Campus, okay? Specific. All right, so I want to give you some resources. I know that some of you stay focused in the CSU library. I would like you to start branching out into Google and the regular internet and use your proper, discernible, critical thinking skills to tell the difference between a credible, trustworthy website and information that is going to give you benefit, or a piece of space junk floating along the internet. And you know that there's lots of space junk on the internet, okay? So to get you started, excellent health information technology resources, the Office of the National Coordinator at healthit.gov, great information, easy for you to understand, case studies, good examples, really very beneficial and very trustworthy. HIMSS, the Health Information Management Systems Society, www.himss.org, and AHIMA, the American Health Information Management Association, ahima.org. Okay, so that's good. I'm going to post this in announcements as soon as we're done here. So you will have this, very important. I want you to bookmark these or make them a favorite depending upon what system you're using. Okay, so patient safety concerns are something that you must be alert to. Whether you are on a clinical side dealing directly with patients or on the administrative side, the fact is we all must be part of the team that looks for ways to prevent adverse events. Now, you may see the initials HAC, which stands for hospital acquired condition. That is when the patient comes in and during their stay, they get ill or injured, which is a no-no. Okay, hospital acquired condition, we want to do everything possible to avoid those. Never events, and I had a friend of mine, oh, it took me 20 minutes to explain this to her. So a never event is an event that should never happen. Okay, also known as a sentinel event. This is things such as when a surgeon leaves a sponge or an instrument inside of a patient. That should never happen. Wrong side surgery should never happen. Okay, so we in health information management using technology can greatly reduce or help to reduce these adverse events. And there are 3 types of adverse events other than those that I just mentioned that you need to know about that we as health information technology professionals can support to prevent or at the very least reduce. The first is preventable adverse events, and these are due to error or failure to apply a certain strategy. Now, yes, this may be a physician not reading the documentation properly, or a nurse misunderstanding, or it could be wrong information entered by the patient registration individual in the system. We want to be able to do as much as we can to use technology to prevent this, and there are ways that we can help. You know, to err is human, okay? Human beings are going to mess up. But honestly, technology gives us a great opportunity to reduce the number of times humans mess up. So this is something we definitely want to look at. What can the technology do to help others prevent errors, like alerts coming up, something like that? Ameliorable adverse events are events that, while they may not be preventable, could be less harmful if care had been different, right? So this might be something like, I can't think of an example right now. How terrible is that? But you can think about something that's not preventable, like a hurricane, but could have been less harmful if, what? If we had kept staff members and patients inside the building during the worst of it. If we had emergency backup generators to kick in when we lost power, so nobody would get hurt walking into something because there was no light. Okay, there's always something. Adverse events due to negligence, and these are flat out things that fall below the standards expected of clinicians in the community. And while we may not be clinicians, we're on the administrative side, we can do things to reduce the number of times this can happen. Okay? And there are lots of ideas and lots of things that you will learn about as we move through this course. But again, you need to know what you're looking for. And overall, what I'm going to tell you I want you to look for is I want you to look for knowledge and hold onto it in a form that you will be able to use that knowledge. I want you to be able to take what you learn, and when you get on the job, which might be tomorrow, because I know some of you maybe are working in the industry, or it might be in 6 months, when you get on the job, you remember and it's like, oh, wait, I learned about that. We can do this, that, and the other. And wow, we get to save some patients' lives. It's pretty cool, especially for us on the administrative side. Okay. All right. Some of the top patient safety issues for 2020. Oh, COVID-19. How could that not be first, right? I mean, this is something that has affected everyone on the entire planet Earth. In every single country, we are seeing this. We are now at this moment in the United States self-isolating or self-quarantining. Hopefully that's what you all are doing and that you're not ill or have family members who are ill. But the good news is, that finally we are getting a handle on it. We're getting a handle on it with help of those countries that have come before us, like South Korea and Italy, as well as the great people in the United States, like Dr. Fauci, who is from the National Institute for Allergy and Infectious Diseases. And we can take care of this. And those of you who might be working in a hospital are certainly on the front lines. And so you're seeing this and knowing how you can participate and help. Technology can help with this. We can have patients check in using an online form or an iPad, okay, so that there does not have to be face-to-face closer than 6 feet. We can do lots of things and contribute to keeping healthy people safe and continued healthy. But once this has moved on, and it will, and we will be better for it. We will be a better society for it. I believe that. There are going to be other things that we can look to attend to this year and moving forward and use our technology and our knowledge. Remember, in health information management, health informatics, we are the collectors of data, we are the protectors of data, and we make data available to those who need it, in addition to doing the analysis of the data so that we can provide others with usable information based on fact and not perception or opinion. So at some point, we will be able to move forward with from COVID-19, and in some cases alongside this issue, because there are still going to be other illnesses. There are still going to be other patients. There are still going to be pregnant women. And we definitely, at this point in time, do need to keep an eye out and learn more about behavioral health, because it seems the entire world right now is at an all-time high stress level. And that is because on top of regular daily stress, on top of work stress, on top of family stress, we have this unknown thing, this virus that is shutting down movie theaters and restaurants and keeping us in our homes, working remotely, I hope, excuse me. And it's very important that that we watch out for the mental health of ourselves, our families, and others that we engage with, whether it's coworkers or friends. Be understanding, be empathetic. There are some people who at times like this just freak out, oh my gosh! Sorry if that was loud. Okay, and then there are others who are calm and clear-headed, and we're going to deal with this, and we're going to make the best of it, and we will come out better for having this experience, without question. Okay, so the good news is, as I said before, we're online, so we can continue with our education, and you're going to have to fit everything else around it, but pay attention, because everything is healthcare related in this, and you can learn from it and use that knowledge in the future. Okay, some more quality resources. I want you to keep online or on file, and this with regard to what we've been talking about. The Joint Commission, Becker's Hospital Review, and of course the Agency for Healthcare Review and Quality, AHRQ. Excellent, quality, credible resources for you to use with any of the topics at hand. Okay? All right. So as we look at healthcare reform, I'm sorry, my dogs, you know, when I adopted Oliver, he did not come with a mute switch. Okay. Patient safety indicators are on the list of ways, measures, things that are used to judge the quality of a healthcare facility. And this is something you should get to know about. They are a set of indicators or measures, as I said. Potential in-hospital complications and adverse events following surgeries, procedures, and childbirth. These are used to create and implement corrective measures. Now, the federal government does keep tabs on this, but we on the inside of the facility should do this as well, because better we should identify any potential problems and fix them or correct them as soon as possible than wait for the government to come in and do an audit. Nobody wants that. Okay, so the PSIs include, okay, for you to identify potential adverse events that might need further study. This is how we use information in the EHRs, including external cause codes, which are ICD-10-CM diagnosis codes that will be entered by the coders in the Health Information Management Department to pull a report and to help us identify potential problems. Now, you might look at an adverse event and say, oh, that might be an allergy to a medication, an unknown allergy, but it also might be equipment that's not working properly. It might be the buzzer on the bedside that is not ringing into the nurse's station, so when the patient needs help right away, they're not getting it. It could be many, many different things. It could be behavioral. It could be physical. It could be a dark staircase. Well, we got to get more lights in there so people don't fall or trip on the stairs. Yes, people should take the stairs too. Okay. Eliminate complications occurring in a hospital that may represent patient safety events. Okay. One mistake is one mistake, human error, we could understand that. If the same complication, like an infection coming out of surgery suite B, keeps happening, we're the ones that need to be watching the data to say, wait a second, that's the third infection coming out of surgery suite B in the last 2 weeks. We got to go in there and take a look at how it's being cleaned or sterilized or what's happening. Okay? Designed to detect patient safety events on a regional level. And this has to do with sharing information with other hospitals and other health facilities. And remember that there might be things on the outpatient side, not everything on the inpatient side. But the point is that we have the ability to collect this data. We have to make sure that we're identifying what specific data we need to collect. We need to collect it, and then we need to analyze it. We need to keep an eye on it to see what is happening, and are we trending something? Is a pattern forming that can identify, oop, there's a problem here, we have to go investigate and fix it. And wouldn't you want that from the hospital where you take your children? Okay, now the last thing I want to talk to you about this evening are your research sources. This goes for your research for your discussion posts as well as for your papers, your critical thinking papers and your final project. Trust me when I tell you this. I am a stickler for APA. I am a stickler for current information. I am here as your instructor to give you information that you can use on the job tomorrow or 6 months from now. It's not going to help you to be using and gathering outdated information in your studies, in your discussion forums, posts, in your discussion posts, in your papers. I do not want you to get stuff done just to get it done and cross it off your to-do list. I want every one of these assignments to have long-lasting value to you. And the only way they can have, not the only way they can have value, but one very important part of value to you is this. It must be current information. Otherwise, this is not a healthcare systems class. This is a history class. And trust me when I tell you, you don't want me teaching you history. Okay, so when anything having to do with healthcare technology, which by the way is pretty much this whole entire course, no more than 3 years old. 2020, 2019, 2018. I do not want to see any dates on citations, on sources older than 2018, with rare exceptions. And I will be checking, by the way. Okay? All right. Other healthcare topics no more than 5 years old. That means no older than 2016. And I will be checking that also. You must use trustworthy and credible sources. That means very, very limited commercial.com sources, lots of .gov and .org. And make sure the org is a healthcare organization, not a consumer organization like the American Heart Association. You want a professional industry association like the American Hospital Association, the American Medical Association, AHIMA, HIMSS. Okay? This here at the bottom of your screen is a link to a video that I created on how to research anything. This will help you understand and give you tips on better quality research so that the sources you are absorbing information from will provide you with knowledge that you can use to get a promotion or to get a new job, not one that will lose you your promotion or your job. And remember, if you go into an interview and you start talking about things like they were in 2013, the interview is not going to say anything to you. They're going to say, thank you very much for coming, and then you'll never hear from them again. So you have access to new information that was published yesterday. Why wouldn't you use it? Exactly my point. Okay, now you're going to have questions. You're going to want some maybe additional explanations. So the assignments, I did not write them. Some of them, I think, you might say, I'm not quite sure. Email me. I am in my CSU Global email box every day, 7 days a week, rain or shine. Okay? We can email back and forth. We can set up a phone appointment and talk things through. Sometimes, you get to the point where I don't really know what to ask, but I don't know what to do either. That's a good time for us to set up an appointment and we can talk it through. Okay? So email me. I promise you a response within 24 hours. And I am in the course every day, 7 days a week. So you'll see me one or the other places. Okay? All right, thanks for listening. Please don't hesitate to email me, to ask me a question. I love it when students ask questions. Have a good evening.